Hello, good morning, everyone. Good afternoon, I should say, in Arizona. It's still good morning in California. Welcome to our broadcast. We love Nogales. Um, Thanks to everyone listening and watching this recording today. My name is Eladio Pereira. I'm the Chief Medical Officer at the Mariposa Community Health Center here in Nogales, Arizona. This is part of our effort for community engagement and education on various topics. And in this case, is cardiovascular health. I have two distinguished guests with me that are going to talk to that and that specific topic, not just on some of the clinical issues, but the educational issues and public health consequences. I'm going to uh, ask Dr. Sultani to introduce herself, and then Dr. Cullen will do the same. Dr. Sultani, thank you. By the way, I want to thank you for your persistence in education. I think thanks to you, we're doing this. I'm grateful, and thank you for everything you do.
Oh, it's my pleasure. Thank you so much for inviting me. I'm a big fan of We Love Nogales. I think you can see on Facebook I'm a top fan, so I'm very grateful to be here. My name is Lisa Soltani. I am a primary care physician and medical director, one of the medical directors at El Rio Health in Tucson, and our group here, including Dr. Perea and Dr. Cullen, who will introduce herself in a minute, are part of the Southern Arizona Hypertension Control Collaborative, which is a long name. We shorten it to SAC, and basically it's a group of community health centers and health departments here in Southern Arizona where we really try to focus education and intervention to create healthy hearts for all of us in our community. So thank you again for having me.
Thank you, Dr. Sultani. Dr. Cullen.
Yeah, well, good afternoon and welcome. Thanks for watching this broadcast. And I really want to be grateful to the participants here, but also to you for listening. I am Terry Cullen. I'm a family medicine doc, though I am now the Pima County Health Department Director. That's been my job for almost 6 years. I'm coming up on my anniversary here. Part of the health department's mission is really to improve the health status of everyone in the county. Uh, and the reason why we want to do this is to make sure we all can live in a healthy and secure place. So one of our roles is to work closely with other healthcare systems, El Rio, Nogales, other federally qualified health centers, Banner, TMC, to make sure that we are providing appropriate education, but also access to care. So we are grateful for this opportunity to be able to share the perspective from the public health department on heart health as well as hypertension.
Great introduction. And again, I want to thank you for your time. Um, we are concerned about cardiovascular health. It's a major issue in terms of morbidity and mortality, disability in this country. Um, Maybe we should start with some of the public health issues that relate to cardiovascular disease. I know Dr. Cullen has been a major driver of risk reduction in Pima County because of the awareness of the potential issues, particularly in terms of disability. So we'll begin with Dr. Cullen to summarize some of the consequences of cardiovascular issues and maybe some of the efforts that Pima County is working on to enhance awareness and reduce risk.
Great, thank you so much. I think it's important to note that the number one killer in Pima County is what we call coronary vascular disease. That has multiple causes, including hypertension. Left untreated contributes to coronary vascular disease. Coronary vascular disease sounds like a big word. It's when you have a heart attack. It can also be when you have other symptoms that happen to you or conditions that occur. What we know is that many people die early because of coronary vascular disease. So they lose years of what we call productive life. Because if you have a heart attack, if you have other conditions related to coronary vascular disease, like peripheral vascular disease, where you have pain in your limbs, you may have a significant impact on your life and your ability to live pain-free. So the major component and emphasis for the the county health department is not just access to care, it's also prevention. And so the county itself, from the health department, has lots of initiatives right now that we work on. Many of these you've heard about are, we encourage you to not smoke, we encourage you to walk, we work closely with Parks and Recreation to make sure that there are safe environments for you to participate in exercise, to swim in the summer when it's hot. And healthy eating is also a really critical component of ensuring that you can stay healthy. Part of that is a healthy produce initiative, as well as access to produce prescriptions, which means your doctor themselves say, this is what you should eat to be healthy. The other thing that we know that contributes to that is really your ability to be at peace and to be calm. And so we work a lot on services that help ensure that people have access to training that will enable them to be calm, to meditate, to know how to seek services. And part of that is also a commitment to behavioral health and ensuring that people who are struggling because of life situations, experiences, that they have access to appropriate care for the behavioral health. So overall, and Dr. Soltani is going to talk a lot about many of these other things, but overall, I think what's important to note is that you don't have to develop heart disease. One of the things you can do yourselves are engage in lifestyle that will help decrease your chances of developing coronary disease, hypertension. So together, it's really important that we ensure that there's resources available for you to take advantage of so that you can evaluate yourself from a clinical perspective, a medical perspective. I am a medical doctor, but also at the same time from your environment, from your family, and the ways that we can help you be able to address these other concerns.
Thank you, Dr. Collin. And I want to take advantage of your public health expertise. Cardiovascular disease carries a significant burden in our community because of the complications. Can you talk a little bit about the public health perspective in terms of burden of disease and some of the complications that occur from either unrecognized or poorly treated, either established disease or preventive strategies?
Yeah, so the burden of disease from coronary vascular disease is huge. It's the number one killer in the county. Second is cancer. But that number, that fact somewhat obscures the burden of the individual impact and the impact on families. So what we know is that if you develop coronary disease, cardiovascular disease, and for instance, you have a heart attack, you may find that you have a burden for the rest of your life in terms of how quickly you can walk, what exercises you can do, if you can pick up your grandchild, if you are able to participate in sports that you have always loved to do, if you want to go on that 1 mile hike and you're unable to do that anymore. At the same time, there are other complications of vascular disease. The one you're probably most familiar with is stroke. Is that when people have a stroke, they can have significant impact in terms of what we call their cognitive abilities, their thinking abilities, but also their ability to move, because a stroke can affect not just your mental abilities, but your physical abilities. So heart attacks and strokes are the two things that most people think about when they think about coronary disease. The other things that happen, however, that I alluded to are peripheral vascular disease. That's when your legs hurt. And it's because the blood flow is not happening because it's impeded or it's decreased because of your inability of your blood to flow back to your heart well. You see that sometimes in people that are really swollen, and there are people that say, my legs really hurt at night. What we know is that all these conditions are potentially preventable if we do the appropriate thing. There's also the disease burden on the healthcare system. So we're talking about disease burden on the individual, but the disease burden on the healthcare system is critical. What we really want to do is ensure that people have access to appropriate care, but also that we use the healthcare system appropriately. And part of that, to use it appropriately, is for the health department to work with you to prevent your needing to go to the hospital. Our goal is to keep you out of the hospital. It's to keep you healthy. It's to keep you at home. It's to keep you active so that you can do the things that you love.
Great summary. Thank you for that, Dr. Cullen. And I'm going to address my question out to Dr. Soltani. You're a clinician, see a lot of patients with not just risk factors, but established disease. Um, what are the initial comments you can make in terms of our strategies for a better health and risk reduction? I think you alluded earlier about some essentials in terms of what we can do. Um, I think we're aware of some of these issues in terms of high cholesterol, high diabetes. I think there's more awareness. Sometimes a little worry about hypertension because we know that even slight elevations in blood pressure create risk. So, what are your thoughts on that recognition and the things that we can be doing to promote better health?
Yeah, I think that's a beautiful question. I think it summarizes so much. And it's February. February is annual Heart Health Month, and so this is why we try to take some extra time to really delve into all the ways that we can be healthier from a heart standpoint. And that those are the same kinds of healthy lifestyle and disease reduction that Dr. Cullen referenced that also will keep strokes away, keep heart attack away, keep vascular disease in our legs away. And I think sometimes we confuse people, or we maybe make it complicated because we're talking about all of the different risk factors, and they seem like many, many things to be afraid or worried about. But I do like this month in the sense that it summarizes that what we're really trying to do is keep hearts healthy. And in order to do that, there are a combination of ways that we can live our lives, so healthier changes that we can make in our lifestyle and the way we live, and then things that we can do from a medical standpoint, meaning the conditions that we need to control from with medications and with our primary care providers and our other healthcare providers. So I think Dr. Cullen did a really great job really talking about all of the lifestyle things that we can do and all the ways that our county health departments really work to make that easier for us, in our complex lives and balancing work and kids and parents and, all the things that we have to balance. The things that get squeezed out of our lives are the very things that we need to keep us going. So, some attention to the kinds of foods we prepare and eat, trying to not smoke and trying not to use cigarettes as the way that we reduce stress, trying to not use alcohol as the way that we reduce stress. And really probably most important is trying to get some physical activity into each day. And those are kind of the lifestyle things that go with heart health. Your question, I think, for me specifically, are what are the clinical or medical conditions that impact heart health? And again, in a way, I like to think about things in a simple way. And a colleague of mine taught me to think about the ABCs of heart and body health. So the A, as you alluded to, is related to diabetes control. So that doesn't sound like an A, but the A is A1C, which is the average blood sugar that we have, had over the last 3 months. And people who are living with diabetes certainly know what I mean when I say by A1C, but it's really whether to know that if you have diabetes, whether your sugars are under control, and even for the rest of us who may not have diabetes, to really understand that unfortunately, all of the foods that come pre-prepared in our environment have a tremendous amount of sugar in them and are always pushing us closer and closer to diabetes. So really to be mindful about how much sugar we're consuming, even if we don't have diabetes. So that's the A. The B, as you said, is blood pressure. So, many, many research studies have now come to the conclusion that probably the number one risk factor for heart attacks and strokes, in the United States is uncontrolled blood pressure. And the reason why that's very tricky is that blood pressure is often a silent condition. And we say that because many, many people have blood pressures that are higher than are healthy for them, but they are unaware of that because High blood pressure often does not give us any symptoms until it's already causing significant damage. So that's the B, knowing what your blood pressure is. And C is knowing what your cholesterol is. So cholesterol is the amount of essentially fat that floats around in our blood, and after a while it cakes the insides of our arteries and doesn't allow sufficient blood flow to all of our major organs. And cholesterol is something that, yes, it's associated with diet, it's associated with exercise, but we also have excellent medications, what we call statins, that most people can take without difficulty that really help to control that. So I guess I would summarize that from a medical or clinical standpoint, we should all know our ABCs about ourselves. What's our sugar, what's our blood pressure, and what's our cholesterol?
Great summary. If you have someone watching this recording today and say, Dr. Sultani and Dr. Cullen made me see the changes I need to make, how will you start? What are the kind of things that someone who's at risk start working on this? It could be pretty overwhelming, but if you had to choose two or three starting elements today, what would that be? Dr. Sultani first, and then Dr. Cullen. Or maybe Dr. Cullen first, because I know she's eager to answer that.
Well, first off, it's such a great question, right? And it's sometimes difficult to imagine what can I change. So I'm going to talk about the lifestyle stuff, and I'll let Dr. Sultani talk about the ABCs that she talked about. The one thing I want to remind people is those ABCs can all be silent. And so it's really important, and I'm sure Dr. Sultani can talk about that, about how you got to check for them, because you may not know that any of those are going on because your body just may be adjusted to it. So what we do when we work with patients is we do have this concept called shared communication, shared decision making. And in this case, it really makes sense. So what are the things that are important to you in terms of your life? And what do you think you can modify? So for some people, quitting smoking, if they're smoking, can be so difficult. And they can say, I've done that 20 times. I'm not going to try again. It's not going to work. I would argue that there's lots of new ways that we're looking at smoking. But perhaps what you want to do is walk with your grandchild, or walk down the street, or be able to go to the store and not feel out of breath. So in that case, what we would do is really encourage you to start being active. I think it's sometimes a misnomer that people think, oh, I have to walk all around the block and the block's really high. Far, you don't have to walk around the block. You can start walking 100 feet, right? And when we talk about getting healthy, what we also look at are what's available to you. And for some people, they don't have a gym membership. They're not going to get a gym membership, blah, blah, blah. So what's important to note is that lots of this stuff can happen at home. Initially, when I first started doing weights, I filled up, and not that I drink Coca-Cola, but I would fill up Coca-Cola, those plastic bottles, and then just go up and down with them to get some weightlifting. So it's not like you need to spend money or have access to a lot of resources to be able to do a lot of this. And I think the other thing we have to remember is, so be active, try to eat healthy. And normally the best way that I've found to do that is to say, what's the number one, is there one food that you believe is contributing to your not eating healthy that you can eliminate? So could you eliminate chips? Could you eliminate soda? Could you eliminate fried foods? So it's really a decision with you, especially, and in terms of your family, right? Especially if you're the one cooking for your family, you have to obviously take lots of things into account. But remember, we're trying to change lifestyle, not only for you from a public health perspective, but from your family and for the community. So we want to make it so that it's safe, easy, low, what we call low barriers for you to do any of these things. The other thing I really, and Dr. Sultani and I recently did some radio, I really want to remind people that some of this is being present. The world can feel a little chaotic these days for people. And I think just remembering that your breath is really important, and your breath can help relax you. So breathe in for 4 seconds, hold it for 4 seconds, release for 4 seconds, and just try to be grounded. I always tell people when they're anxious to put your feet on the ground and ground with the earth. And hopefully that will help relax you. We know that if you can relax, your blood pressure goes down. So it helps you become healthier.
Thank you for that. And I like your idea about walking. You don't have to run or exercise heavily. Maybe taking the stairs instead of the elevator, maybe park away from the store and walk a few more steps. So those are sort of
Yeah.
initial things that we can all be doing. You mentioned this earlier about smoking. Quitting smoking is high yield in terms of risk reduction, not just in terms of cardiovascular risk, but cancer risk.
Mhm.
And I know we're not going to talk about this today, but a quick reminder that when you're smoking, there are new guidelines that we've had for a while now about screening for lung cancer. So that's something you have to talk to your doctor about, whether you qualify for lung cancer screening with a low dose CT scan every year. But it's high yield. It reduces risk very quickly. And I wish we could do more. I know it's difficult, but it's a very high yield.
And I think the one thing people need to remember that vaping doesn't protect you. Vaping is smoking. It's going into your lungs. So it's not just cigarettes or cigars or
Yeah.
and chewing tobacco also counts. So all these different ways that tobacco can enter your body are really important. The one thing I would remind people is there are many, many resources to help stop smoking. Many of them are free, independent of whatever kind of insurance you have. The county provides lots of opportunities for people to quit smoking. And so if you have, even if you don't know if you want to quit, it's important to just have that discussion to see
Yeah.
what can be offered to help you get
And
on
many
that.
resources available. And we hear a lot in medicine, never quit quitting. We hear a lot about patients frustrated. I've tried 5, 6, 7, 8 times, 10 times, but never quit. I think our duty as healthcare professionals is to encourage all patients to keep trying. At some point, some of them will quit, and the yield will be very high. Thank you, Dr. Collins. Dr. Sultani, can we expand a little bit of some of those essential elements that you mentioned earlier before we began the recording about summarizing those? And in prior recordings, you summarized it briefly, some of the outcomes that we get out of those essentials. You don't have to go through all of it because we would be here a long time, but can you summarize a few things that you believe are important?
Yes, I'd be happy to. Thank you for that question. And, I want to thank Pima County because they really have put up a lot of resources to help us stop smoking. And I hope people are aware that online you can go to tobaccofree at pima.gov to find some of those resources. The Arizona Smokers Helpline also will provide some free counseling and also some vouchers for products to help people stop smoking. So I think for those of us out there who are still smoking, that's probably the number one thing that we can really help you to get under control and that will significantly improve your health overall. I think the other things that we think about, from a medical standpoint, just going back to those ABCs, is really, I hope and pray that most of us have access to some kind of primary care and are maybe getting a physical at least every couple of years to get, when people come in for a physical, we do routine blood work where we check for diabetes, we check for cholesterol levels, we check your blood pressure. And so, as Dr. Cullen pointed out, to know your numbers, know what your sugar is, know what your cholesterol is, that unfortunately requires that you have some encounter with the medical system so that you can get labs done. Um, Happily now, from the blood pressure standpoint, people have more of those tools in their own hands. And I'm just going to show one product. It's not to really push this brand over any others, and I'm not sure if you can see, but the idea is that we can now get a home blood pressure monitor. You can buy that without a prescription at Walgreens, Target, many of the local pharmacies and stores. We do like to have people use the upper arm blood pressure monitor. Those are much more accurate than the wrist monitors in terms of getting an accurate blood pressure number. But you can buy an upper arm cuff. Many of them are in the range of $25 to $30. There are some brands that the American Heart Association has tested and can vouch for as being much more accurate. At El Rio, we use a brand called Omron, which is on that validated list. But they all basically work the same way in the sense that, they allow you to put the cuff on your arm and press a button. You don't need to have any specialized equipment. You don't need a stethoscope. And those monitors generally will have a memory that will save the numbers there. And the reason why that's important is, hopefully, you do have a primary care provider and you're seeing them a few times a year. But even that, from a blood pressure standpoint, is probably not enough information for us to know that your blood pressure that is impacting your body and your blood vessels every second of every hour of every day of your life. We need probably more than just two or three times of checking throughout the year to know that that blood pressure is under control, majority of your life. So that's why now there is a strong recommendation. The American Heart Association, in their most recent guidelines, made a recommendation that anyone who might have high blood pressure or does have high blood pressure should try to get one of these home monitors to be able to use at home. And there are some recommendations about what's the best time and way to take your blood pressure. And I could certainly talk a lot more about that, but I don't want to take up too much time. But I will point people to there's a website called Target BP, which is an American Heart Association website that has a lot of wonderful information about how to live healthily, but also specifically around how to check your own blood pressure. There's pictures that show what's the best way to do that. And then once you start to do that, I would strongly ask you to please bring your monitor with you to all of your medical appointments because that allows your primary care provider to run through those blood pressures that you have saved on your monitor so that we can really make a good estimate of how well your blood pressure is doing at home.
Great summary. Dr. Sultani, what is a normal blood pressure? We hear a lot 120/80, 130/80. When should the patient say, I need to see someone, I need to
Yeah.
see a doctor. This is important. I can do a few things on my own. Do I need medication? You hear a lot of people on medication, that they're on medication, but
Mhm.
what is normal and when should someone seek medical attention?
Yeah. So again, that's such a great question, and I know that sometimes it gets confusing because we're listing so many numbers, and I sometimes feel sad that people have to remember all those complicated things. So I just try to make it simple that if your blood pressures are running close or over 140/90, so if you've already hit 140/90 or you're anywhere above that, that is, a really strong reason to get in to see a provider, and likely at that point you really need medication to control blood pressure. So, as you said, there's many lifestyle things that we can do to bring our blood pressures down. But once we get into that 140/90 or above range, then I would say, it's not an emergency that you have to go to the ER for, but it is an urgent reason to see a provider because at that point things are serious with the blood pressure. And the reason is because a normal blood pressure is closer to 120/80 or lower. And not many of us adults have blood pressures that are running that well. So we probably all have some room, again, through lifestyle and other ways to bring our blood pressures down. We know that avoiding sodium, So, people say salt, but it's really the sodium component of salt that we need to try to avoid. And just remembering that when we go out to eat or we're eating packaged foods, often those have a lot of sodium already in them. So, not to add any table salt to your food, to be looking at the numbers of sodium in your foods and trying to avoid sodium. There are some ways that you can use seasonings that have potassium, for example, as kind of that flavoring that are going to be much more heart healthy for you. Eating foods that have some fresh vegetables and fruits, again, not smoking, really reducing the amount of alcohol that we're taking in, and exercising, even if it's a walk a day type of exercise. We know those things, all of those kinds of things have profound improvements on blood pressure. But I would just say that, if we're trying to remember one number that we don't want to ever go above, it's that 140/90 number. I think you're on mute, Dr. Perea.
Sorry. Sometimes we think that we have to lose a lot of weight to achieve a blood pressure reduction. We get frustrated. I need to lose 10, 20 pounds. That's not the case. Sometimes a minor weight loss will achieve a significant change. Can you comment on that, Dr. Sultan?
Sure, I'd love to. I mean, I think we're all working on our weight to some extent, trying to maintain a healthy weight. And I think, as you pointed out, we don't have to all be carbon copies of one another. We all sizes and shapes can be beautiful. But sometimes if we know that we're above a healthy weight, even reducing by 5 to 10 pounds can have a very, very important benefit to your health and help you feel better, number one, but also really help to improve other parts of your health, including blood pressure and sugar and joint health and other parts of your health. So even 10 pounds, we say, can be really beneficial.
Great, thank you for that. Um, I think we covered a lot today. Um, awesome job by Dr. Sultani and Colin. I think before we conclude, I'd like to ask Dr. Colin, Dr. Sultani, is there anything else that you'd like to offer today? We want to have more of this, more follow-up in terms of specific interventions and so on, but I'd like to have Dr. Colin's final comments for today.
Well, first off, thanks everybody. Hopefully you enjoyed this. Hopefully we addressed some of your concerns. I also want people to leave with a sense of optimism. I think what we know is that it is possible to live healthier lives. And as a community, as a public health department, I have a responsibility to help you do that. So please reach out to the health department if you have any questions. We do run 3 clinics that are open to everyone, independent of ability to pay, in the Tucson area. We work closely with the federally qualified health centers in Nogales and in Cochise County. So there's lots of opportunities for you out there. And I would just remind people that many of the things we do that we need to do don't cost money. They're really how we can make intentional choices for us and for our family so that we can live a healthier life. Finally, I want to remind people, however, there's a heart walk. It's April 18th. It's in Tucson. You don't have to be a member of a team to join. It would enable you to be surrounded by people that care about their heart and care about their health. And remember that we are a community collectively working together and caring for each other. Thanks.
Thank you, Dr. Colin. Dr. Sultani?
Just again to thank your listeners and viewers for their interest and wish everybody happy and healthy Heart Month. We talked about so many points today, and I think if people want to get additional information, I would again direct them to the American Heart Association website and specifically to information that's called Life's Essential 8 that really review the lifestyle and the medical parts of heart health health that Dr. Cullen and I and you spoke about today. So I think that's a nice review. And also I want to put in a plug for there is a a health fair tomorrow at El Pueblo Neighborhood Center from 8 to noon. And all of the public is welcome to come, and I will be there. And I know Dr. Cullen's team will be there as well, and we'll have plenty of materials and be able to check your blood pressure and talk to you about heart health as well. So hopefully looking forward to seeing many of your viewers and listeners there.
Great, Dr. Soltani. And my final comments relate to what Dr. Collins said about optimism. Some of these things we talk about are modifiable. We know that quitting smoking is possible. The others that are high risk, hypertension, diabetes, and cholesterol, do require a measurement of some sort. They may have no symptoms. We know hypertension could be silent. We know diabetes could be silent. We know high cholesterol could be silent. So having access to healthcare is important, like Dr. Sultan said. Blood pressure needs to be measured. Blood sugar needs to be measured, and cholesterol needs to be measured. So I think having access to healthcare, knowing those numbers and acting on them, but they're treatable. And I think that the risk reduction can be very significant for a healthy life. So thank you so much to our guest today. I'm just honored to work with you and do this with some frequency. I hope to do it again very soon. For those watching or listening, thank you so much. I would like to thank Dr. Soltani, Dr. Cullen, and of course, we love Nogales, Edgardo Munoz, and everyone for making this possible. Such an honor to work with you. Thank you so much. See you the next time. Good day.